Good afternoon, everyone. You are very welcome to the HSC Health and Wellbeing Effective Communications on Child Health and Obesity webinar. The panel would be delighted to receive any questions you may have. Please use the Q&A feature located at the bottom of your PC laptop screen. If you are using an iPad, you will find this feature located at the top of your screen. Now, without further ado, I will hand you over to your host for today, Sarah O'Brien, National Lead, Healthy Eating and Active Living Programme, HSE Health and Wellbeing. Thank you. Sarah, we'll just ask you to unmute yourself, please.
Apologies. Good afternoon, everyone. Welcome to our Effective Communications for Child Health and Obesity webinar. I'm delighted to have you all here with us on this lovely March morning. Jean has said that we have a Q&A open as the webinar is going on, so please do use it. We will endeavour to ensure that we cover the themes that are coming through in it when in our panel session later on. We may not get to deal directly with individual questions because there are so many of you here, and it's absolutely fabulous. So the webinar as well is being recorded, and we will send you an email afterwards with the link to it for any of you who want to listen back or maybe share wider. We don't have a specific hashtag for today's event because it was a fairly closed event in terms of the invitees. But if you happen to be sharing or commenting on anything you hear online today, do please tag us at HSE Health and Wellbeing. So as Jean mentioned, I'm Sarah O'Brien. I'm the National Lead with the Healthy Eating Active Living Programme here in HSE Health and Wellbeing. In HSE Health and Wellbeing, we work closely with colleagues in the Department of Health in the wider health services and other public agencies, as well as with community and voluntary partners to support the implementation of the Healthy Ireland framework. The Healthy Eating Active Living programme in particular has a remit to mobilise the health services to improve health and well-being, and by increasing the levels of physical activity, healthy diet and healthier weight across the population as a whole. And we put a particular focus on children and families. We've recently published the second implementation plan for the programme, which sets out 3 key areas of action for us: providing leadership at policy and practice level, promoting behaviour change for healthy lifestyles, and strengthening capacity to prevent childhood obesity. Today's webinar and the guide we're launching form part of a much wider programme of work in collaboration with our colleagues in the National Healthy Childhood Programme, which focuses on strengthening the capacity to prevent childhood obesity. Some elements of this work includes bespoke research with parents on their health and well-being priorities, preparing a HSE Healthy Weight for Children action plan to connect and coordinate initiatives across the organisation that contribute to childhood obesity prevention, work with the child health governance groups and their regional Healthy Weight for Children implementation groups across the country to put a focus on local action to deliver on core outcomes in this area. We have new evidence-based information for the public on hse.ie Health A to Z section on childhood weight, and we currently have a Google search campaign live to help better connect parents with this really valuable information. And we're in the process of developing and testing a standardized nationally agreed approach to the delivery of weaning workshops for parents. In addition to that, over the remainder of the year, we will also be publishing a number of new resources, including a preschool menu plan and also a guide for parents on talking with their child about weight. And we are looking forward to having 2 more webinars that will focus in and around those themes. Through the Healthy Weight for Children group, we work with colleagues in Safe Food, Irish Heart Foundation and the Institute of Public Health, exploring opportunities to collectively champion priority policy and regulatory actions such as restricting marketing of high fat, salt and sugar foods to our children. Over the last 30 years, similar to other countries in Europe and across the world, the levels of overweight and obesity in Ireland have increased significantly across all age groups, social classes and genders. The shift in population level BMI is heavily influenced and shaped by changes in the environment that we are born into, live, work and play in and age in. The unequal effects of these changes mean that our children, young people and adults who experience disadvantage are more likely to live with poorer health for longer and to die earlier than their peers in more advantaged areas. Currently, at least 1 in every 5 children in Ireland live with overweight and obesity, and this rises to 1 in 4 in 17 to 18-year-olds. When we speak about childhood obesity, it's important to know that we are not speaking about body shape and size, because we all come in a variety of shapes and sizes. Our height and our weight, very much like eye and hair color, is very strongly influenced by our genes. However, we know that excess weight can have a negative impact on health over time. So we want to ensure that every child can have the growth and development pattern that is healthy for them. Many of you will be familiar with the complex systems maps from the 2007 Foresight report. This map illustrates the connections and interdependencies across family, community, and society that influence the environments we live in, and these environments have a significant impact on our overall health. The capacity and responsibility to implement the evidence-informed policies and actions that enable change within this complex system lie mainly outside of the health sector. However, in the health sector, we do have an important role to play to speak for and champion for these changes. This requires us to speak with and engage partners and stakeholders in other areas of the public and private sector, as well as with the general public as a whole. And it's important that we make these conversations and communications as effective as possible, hence the webinar today. So today's webinar builds on a workshop we held with Frameworks UK in May last year, which was heavily oversubscribed. So today we're using a webinar format to allow us to reach a wider audience and for as many as people as are interested to hear from us. One of the requests from the participants at that workshop last year was for a practical guide to use themselves and with colleagues. So I'm now very pleased to welcome Veronica Conti, project manager with the Healthy Eating Active Living programme, who has had the task of responding to that request to speak with you.
Thank you, Sarah, for that introduction. As requested, drum roll please, we are very excited to be launching this new HSE resource, Improving Children's Health in Ireland, a communications guide for talking about children's health and obesity. This guide will be especially helpful for speaking to policymakers, decision makers, but also in everyday conversations with colleagues and partners. This guide provides evidence-based, practical communication tips and advice to help shift people's thinking, build understanding, and increase support for policies and programs that will help children thrive. It was written on behalf of HSE Health and Wellbeing by Frameworks UK, a non-for-profit communications research organization who we are very pleased to have with us here today. This guide brings together recommendations from Frameworks UK research into children's health and obesity, the wider determinants of health and related issues, and has adapted that to the Irish context. Each recommendation gives an overview with what and how you can reframe communications and conversations about child health and obesity towards solutions. There are also a number of before and after reframing examples under each recommendation, which I personally find very helpful. As part of the HSE's commitment to climate action, this guide is available in digital format as a PDF, downloadable from hse.ie Healthy Eating Active Living Program webpage. The link will be shared here in the chat and as part of the post-event info for you to download and share with colleagues. I will hand it back to you, Sarah, to introduce our next speaker. Thank you.
Thank you, Veronica. And we are really excited to launch the guide today, and we hope you will find it a really useful tool, because I know we have ourselves, as we've been working over the year developing it. So now I'm going to introduce Sophie Gordon from Frameworks UK to speak with you in more detail. And after Sophie has finished, we will have a questions and answers session. So do pop any queries you have as Sophie speaks into the chat, into the channel. Over to you, Sophie.
Great, thank you, Sarah. Just bear with me 1 second while I bring up my slides. Here we go. Okay. So yeah, thank you so much everybody for joining. I'm Sophie, I'm a Principal Communication Strategist at Frameworks UK, and today I'm going to be talking you through some of those communication strategies and tips which are in this new guide that we've created with HSE, which I hope to be helpful for anybody communicating about children's health and obesity in Ireland. And as Sarah and Veronica have said, this is all based on Frameworks UK's research, which is all about looking at how we can shift people's thinking, build understanding, and increase support for policies and programmes that will help children to thrive. First, a little bit about Frameworks UK for anybody that's perhaps not come across us before. We are a not-for-profit and we specialise in evidence-based communication strategies to shift hearts and minds on a range of issues. So we help charities and other mission-driven organisations to communicate about social issues in ways that will create progress through practical guidance underpinned by our framing research. Now, Frameworks research shows how people understand different social issues. It tells us not just what people think, so not just the sort of things that we might find through attitudinal polls, for example, but we dig a little bit deeper to why people think in the ways that they do. And we then use this knowledge to develop and test different communications approaches that will help organisations to create the lasting change they want to see. Here's just a flavour of some of the organisations we've worked with recently, and you might be able to gather from this selection of logos that we mostly focus on issues around children and families, homes, poverty and health, which will of course be our focus for today. This slide here is total overkill. I don't expect anybody to read it, but I just wanted to illustrate that there's a really substantial body of evidence that we're drawing from today. And all of this is available to you on the Frameworks UK website as well. And we've linked to some of the most relevant pieces towards the back of the comms guide as well. Now, our focus today is, of course, on children's health and obesity, but this has also been informed by other research into related issue areas, such as the wider determinants of health and poverty. Now, importantly, while our research is based in the UK, recent work by the Economic and Social Research Institute does point to similar communications challenges in Ireland. So we see very similar ways of thinking about health and obesity, albeit to slightly different extents. And this indicates to us that the framing strategies which emerged from our research in the UK are likely to be helpful in the Irish context too. So this is a very top-line look at what I'm going to be covering today. I'll do a quick introduction to what actually is framing and why does it matter, then why we need a new story about children's health, and then we'll get into some really practical, applicable communications recommendations, which are covered in more detail in the comms guide. So first of all, what is framing? Framing it's as simple as the choices that we make about what ideas we share and how we share them. So this includes what we emphasise, how we might choose to explain an issue, and also what we decide to leave unsaid in our communications. And this matters because these choices can lead to really radical changes in how people think, feel, and act. Now, all of us are framing all of the time, but when we make these decisions deliberately and backed up by evidence, we can just make them with more confidence that our communications are landing as we intend them to. So let me just start by sharing a couple of quick examples to illustrate the difference that framing can make. First of all, in this classic experiment, the researchers wanted to look at the impact of framing on the choice between different medical treatments. So respondents in this experiment were asked to choose between surgery and radiotherapy treatment for lung cancer. Some of the respondents in this piece of research were patients, some of them were medics, and some of them were students. Now, one group were told there's a 90% chance of survival following surgery, while a second group were told there's a 10% chance of mortality following surgery. Now, for the sort of more, numbers-minded people amongst you, you'll notice that that is the same probability. It's just framed differently in terms of survival or mortality. But these were the results. The survival frame led to a substantially higher preference for surgery. And what's really surprising here is that this framing effect was actually no less pronounced for the medics, so no less pronounced for the people with a really solid understanding of the treatments and the probability. So this is an example of how, regardless of knowledge and expertise, how people are primed to think really can change their understanding and their response to communications. Because our words matter, how we choose to frame our communications matter. It really does shape how issues are seen and understood. Secondly, another example of how framing can change support for policies and programmes. And here, this is a graph that comes from the underlying research that we did with Impact on Urban Health in the UK, where we were looking at different ways of framing the issue of childhood obesity. So these are the results of a large-scale experimental survey in which we had a control group who were asked a series of questions about their support for policy change to tackle child obesity and their belief that society must act on this issue. They are represented by that thick black line along the zero horizontal axis. Another group read a statement using childhood obesity as the central frame. Then they were asked the same questions. And another group still were read a statement using improving children's health as the central frame, and they were asked the same questions. And as you can see in the results here, support for policy change was significantly strengthened when people were primed with this idea of improving children's health. Whereas those who saw the childhood obesity frame, those red bars, that was basically not a statistically significant change. We might as well have said nothing at all compared to that improvement in the results for people who saw that improving children's health frame. So this is a really core idea that we'll come back to in a moment, but I just wanted to surface it early on to show this real difference that framing can make. It's important to also understand that everything is already framed. It's just a question of whether we do so intentionally or not. So I think we've probably all had this experience at some point where we say something and then the person we're talking to seems to hear something completely different. And you might find yourself wondering how you could have been so completely misunderstood. Now, unfortunately, this can happen all the time in our professional communications too. And this is because people aren't blank slates. We all have our own beliefs, our own experiences, and ways of making sense of the world. And because the world is a constant source of information, we develop very quick mental shortcuts to help us understand it, to interpret that information. And we call these mindsets. Now, when we don't understand the existing mindsets at play on any given issue, we can often find ourselves lost in translation. If we don't consider how we frame our communications, we basically aren't giving ourselves the best chance of really being heard and understood in the way that we intended. So that's why our research always starts by seeking to understand what mindsets people hold on a given issue. Now, this is earlier on when I said we want to know how people think, why people think, this is what I'm talking about. We want to know more than just the attitudes which can come and go, but really understanding those mindsets that people are using to make sense of an issue, how they are thinking, how they are reasoning on any given issue. Mindsets are patterns of thinking which shape how we understand the world, and they are implicit and shared and enduring. They are activated by the things that we see and hear every day, whether that's stories in the paper, things on TV, conversations that we have. All of these narratives all around us are constantly activating different mindsets so that we can think fast on any given issue. Now, framing works best when we're able to navigate these mental shortcuts. We understand what they are, and then we strengthen the ones that are going to be helpful in achieving positive social change and avoid the ones that are going to be unproductive and just take us down an avenue that we don't want to go down. So how we communicate about children's health really matters because it has the power to fundamentally change how people understand the problems that we're up against and the solutions that are necessary and possible. In our research, we found that too often communications about children's health and food can trigger and reinforce unhelpful mindsets that can hold back understanding and support for the solutions that we need to help all children thrive. These are the mindsets that we need to be aware of and to overcome in our communications. And I'm sure many of these will be familiar to you. You might just not have thought of them as mindsets as such. So first of all, we found that talking about obesity in particular triggers this idea that individuals are to blame, that poor health is down to individual choices and a lack of willpower. And in the case of childhood obesity, we see people thinking that parents are simply to blame and they are failing in their duty to keep their children healthy. Now, this is not unique to obesity. We see, generally people think of health in very individualistic terms. And when it comes to obesity, there is this sort of added layer of judgment as well, which we need to be aware of. Secondly, people tend to see obesity as an unfortunate and inevitable part of modern life, and therefore they tend to think it's unsolvable. There's a belief that children are just naturally drawn to sugary processed food, and that's just the way it is these days. And the problem with this is that what's missing is context, like marketing practices of big food companies, or what food is actually most readily available in our shops and high streets. People do see this as a serious crisis. People are convinced that obesity is an issue that needs to be tackled, and they see the strain that it's putting on health services. Now, the problem here is that it can just feel too big to solve. People think it's such a big problem that how can you possibly begin to fix it? And when people do reach for solutions, they tend to reason that we just need to educate people to make better choices, and that it's ultimately down to individuals rather than the system and context that surrounds us. But we know that individual level solutions like this, they won't do the job alone. Growing evidence shows that where we live and what we earn shapes the opportunities and the options available for us to be healthy. So we need solutions that take this into account, such as policies and programs to make healthy food more accessible and affordable, or restricting how unhealthy food is marketed to children. But there's a disconnect between this evidence and people's focus on individual choice. And for people to support more systemic solutions, we need to shift people's understanding of the problem, building on existing but less dominant ways of thinking. So what can we do about it? How can we avoid or overcome those unhelpful ways of thinking and build on more helpful ones? I'm going to share 4 of the recommendations from our research, which we have covered in more detail in the comms guide as well. So first of all, make this all about improving children's health. By reframing the issue and making this a matter of improving children's health, rather than making it a matter of tackling obesity per se, we avoid triggering the unproductive ways of thinking that come to mind in relation to obesity. So instead of making people think immediately about individual choice, about blame, or triggering that sense of crisis, it inspires support for solutions and a belief that we must take action as a society. Now, that's what we saw in this graph earlier, that significant boost in people's support for policy changes and a belief that society must act. And this just goes to show how much more powerful our communications can be when we lead with improving children's health. And when I say lead, I mean literally mention improving health first. Make the story about improving children's health. And the reason it's really important to do this early is that what we say first impacts on everything we say afterwards. Once we've triggered a mindset, we can't really walk it back. It's like if I was to say to you, don't think of an elephant. You're all thinking of an elephant now, and I can't really undo that. But if I'd said, think of something else, you'd be thinking of that instead. So triggering an unhelpful mindset like we do when we lead with obesity, it takes us down the wrong path, it takes us where we don't want to go. But when we lead with health, we start with much more helpful mental shortcuts. People are much more able to hear what we have to say and are much more likely to support the policies and programs which will make a difference. Here's a quick example of how we can shift that focus away from obesity and lead instead with health. So instead of saying something like, we need to act now to tackle Ireland's childhood obesity crisis, because too often children in Ireland are eating food that is high in fat and sugar. If we don't act now to reduce obesity, we're setting children up for illness now and later in life. We can instead say something like this: we need to act now to improve children's health in Ireland. Too often our communities and schools are flooded with unhealthy food, but by increasing the flow of healthy options, we can help every child thrive. So it's that shift from obesity to health, but also talking about how we can improve health. It's not just about preventing ill health or reducing obesity. It's framed in that way of what we can improve, how we can help every child to thrive. So we're making that more positive case for action as well as talking about improving food options and improving health. Now, since these framing recommendations have been put into practice by our partners and the conversation has been broadened out to talk about children's health, some further questions have arisen as well. Specifically, if our focus is on children's health and food, and we know that the language of obesity is stigmatizing, some people have asked, should we mention obesity at all? And how could we best name the problem that we need to solve? Is there perhaps a better term that we can use to help build understanding, reduce parental blame, and boost policy support? So we actually carried out some additional research to test this out. And we found that food-related ill health was a really promising term that could be used as an alternative way of framing the conversation. Our findings indicated that this term can play a really important part in opening up thinking about our food systems, how they can be improved, and addressing inequities, as opposed to other terms which can trigger blame and a focus on individuals first and foremost. So what this term is doing is it's reorientating the problem away from individuals and towards the options which are available to all of us. It really has the power to root conversations and the idea that what surrounds us shapes our health. Just a quick look at some of the findings we had in this study. So in the quantitative results, the shifts in thinking that we saw in comparison to the stimulus which used the term obesity, they were small, but they were both positive and consistent. So, for example, we saw small increases in understanding family income as a factor influencing children's health. And it slightly increased agreement that companies such as food manufacturers are responsible for taking action to improve children's health too. Participants were also more likely to choose systemic factors as the main contributors to children's health and weight when compared to participants who saw the term obesity. In the qualitative results, where people were asked, what comes to mind when you think of food-related ill health in children, we also saw that this term led to more mentions of high food costs, cost of living, and low cost of junk food, indicating much more systemic thinking. So, for example, we had responses such as people reasoning that richer people's children have better food than poorer children, people thinking about how the cost of living can reduce the ability of parents to afford nutritional food. And we also saw mention of more specific health issues such as asthma and diabetes, which indicates that more holistic focus on health rather than purely on weight. And it was the only term which led to notable mentions of nutrition and malnourishment. For example, people said, we need to do more to ensure that every child gets the correct nutrition. Importantly as well, only 3% of these qualitative responses referred to parental blame at all, which is a massive difference, considerably lower than for any of the other terms we tested. So while it will sometimes be pragmatic and necessary to mention obesity, this can be mitigated somewhat by focusing on improving health first. With food-related ill health, we've just found an efficacious way to highlight the problems we're up against without triggering that sense of individual blame and judgment in the way that obesity does. So I'd encourage you to consider, could you try talking about food-related ill health instead? Our second recommendation is to make this about all children, no matter where they live. Now, activating this value of fairness between places really helpfully navigates the idea that childhood obesity is not my problem or something that exists over there. We found that it helps to activate this sense of collective responsibility and increases willingness to act and be part of the solution. It also shifts the focus from individuals and groups to their situations and surroundings. Now, talking about places rather than groups in this way helps to minimise stigma, as it encourages people to look at circumstances rather than perceived characteristics or the idea of individual failings. Using a shared value like this idea of fairness between places, a shared reason to care, can bring people together onto the same page and create a bigger us. What it's doing is turning this from a problem that I have to one that we share. And it helps to guide people's thinking and remind them of a reason for that sort of shared need for action. When it comes to children's health and food, we found that talking about fairness between places was the best way to make lots of people care about the issue and support policies and programmes. An example of how this could look, instead of saying something like, we must address inequalities now as they are impacting on many children's health and putting them at an unfair disadvantage, we could say, by making sure every child, wherever they live, can access healthy, affordable food, we could set all children up for a better future. Or we could say something like, from Dublin to Donegal, every child should have the same opportunities to thrive. Now, this idea of fairness between places is a more tangible way of talking about inequalities rather than just saying inequalities. Yes, we can talk about these sort of different places in the country, draw these comparisons to get people thinking about how where children live has an impact on their health outcomes. Some key things to think about to really sort of bring this to life in your communications, really make this about all children, how all children need the same opportunities, the same things to thrive. Highlight how this isn't happening in some places, and remember to focus on those characteristics of places rather than people or groups. This is really helpful for sidestepping stereotypes or inadvertently reinforcing stigma. This is also even more effective when we encourage people to think about a better future. So what does addressing this now lead to in the long run? Why is it important that we, make this possible for every child to live well now? And generally, I would say across communications, using collectivizing terms like we, us, and our, all of that's really helpful for making this sort of collective issue. Now, before we go to the next recommendation, we're going to do a quick experiment. So a poll is going to pop up in a moment. And basically, I'm going to show you on the next slide, I'm just going to show you something. All I want you to do is to simply write in the poll function what you see. Now, there are no right or wrong answers here. This is not a trick. It might seem very obvious. That's fine. That's good. Just write what you see in the poll. We'll give it a few minutes for those to come through and I'll give you the results of the experiment. So here we go. Give you a few minutes to decide what you can all see, and I'll wait for the results to come through. Great. So, Jean, if you could let me know what the majority of the responses are saying, that would be really, really great.
Thanks, Sophie. I'm just going to end the poll now. So just give me 2 moments.
No problem.
Very interesting, Sophie. So mostly people are saying fish.
Fish.
Yes. But again, some people are saying 3 fish falling in 1 fish, 3 fish moving quickly, 1 moving slowly, the different colors, all the same way. So it's really interesting to see the variety in how that's been responded.
Great. Thank you so much, Jean. Okay, so why on earth have I showed you this slide and these fish? What we've basically done is we've just repeated an experiment which is known in psychology inventively as the Michigan fish test. Yes, that is really what it's called. And this was presented to a group of American and Japanese participants in a study conducted by Richard Nisbet and Takahiko Masuda. And in their 5-second viewing, what they found was the Americans paid much more attention to the fish, the main characters of the scene, which is pretty much what's happened just now when we've repeated this. While the Japanese participants had a different overwhelming response where they described the scene much more holistically. They described the coral and the water and then the fish's situation within that, rather than saying, I see some fish. And we regularly repeat this experiment in our workshops and find that people in the UK and Ireland overwhelmingly fall into the same camp as Americans in the study. We comment on the fish, the number of fish, the colours, the fact that one is slightly ahead of the pack. Now, this is unsurprising as our culture is much more similar to the US than Japan. But why on earth am I talking to you about this? What does this mean? Well, this highlights something very important, which is that most of us do not see context. And when we're talking about issues like children's health, our inability to see context becomes a problem, one that we need to and that we can overcome by making certain choices on our communications. Which leads me on to our next tip, which is to show how what surrounds us shapes our health. We need to do more in our communications to show that where someone lives, where they go to school, their family's income, all of this shapes their opportunities to be healthy. Because we know that people tend to think that individuals are responsible for their health, and as a result, the solutions people tend to think of tend to default to just educating people to make healthier choices, rather than making our surroundings more sort of conducive to good health. When we draw people's attention to our surroundings, we show where the solutions really need to happen. We show that people can't just choose to be healthy when the options aren't available or accessible to them. Much like that fish experiment, we need to draw people's attention to the bigger picture. When people can see that what surrounds us shapes our health, it expands their thinking beyond individual actions, beyond just your eat less, move more, and it opens up so many more ways that we can improve children's health. So by telling a different story, we can zoom out from individual behaviour. And this is not just the case of ignoring our individual agency, but it's just about adding context, because too often the healthy option is not affordable or accessible, and to improve children's health, that's what needs to change. There's plenty of ways that we can do this in our communications. So first of all, a really quick switch. When we say options or opportunities, we're highlighting what's available to someone, which is a nod to that wider context. But when we talk about choice, we're triggering that unhelpful idea that this is just down to people needing to make healthier, better choices. So you could talk about healthy options, about opportunities to be healthy, instead of talking about healthy choices in your communications. And even a simple switch like that is helping to broaden out that view of context. Secondly, really harnessing explanation in our communications is key. Sometimes we think we're explaining something, but we're actually just asserting it to be true. So, for example, we might say the physical, social, and commercial environments that we live in have profound impacts on our children's health. But really here, we're just claiming, we're not explaining. Instead, we could say, When we live surrounded by fast food outlets and healthy options nearby are limited or more expensive, it makes it much harder to put healthy food on the table, and this can lead to poorer health in our children. So the sentence on the left is only really going to work if someone already agrees with you. That's because we're just asserting it to be true without giving any further context or explanation. But when we explain, we start to bring people with us because they can follow our reasoning. It's like showing our workings out, and by doing that, it increases understanding and empowers people to make up their own mind whether they agree with us. This makes people feel much less defensive, less likely to default to unhelpful mental shortcuts. And obviously, in a longer piece of communications, we can really dig into explanation much more. We can break things down step by step. But even in a short example like this, where we're just giving an example that brings our statement to life, this is going to be doing much better work for building that understanding of how what surrounds us shapes us. Another way we can explain and show how our context has an impact on children's health is by using the right metaphor. Pardon me. So metaphors are sticky and they give a really strong mental picture. They also make complex concepts much more simple and concrete. And they can help us to explain why something happens rather than letting people think it's normal or natural. Now, not just any metaphor will do, and that's why in our research we test them. We try to find metaphors that are going to be doing the work that we need them to do in our communications. And in the case of children's health and obesity, we found 2 metaphors that are really helpful for building understanding. I'm going to focus on just one of these with you just now, but we've got 2 of them in the communications guide, so all the more reason to check that out. So the one I'm going to focus on is this idea of the stage. We can talk about the impact of advertising practices on children by comparing it to a stage. We can talk about how unhealthy food is in the spotlight and it's playing a starring role in our children's lives, and how healthy food is being pushed into the wings. An example of how this could look, we might say, increased screen time for learning and playing with friends has set the stage for food companies to put unhealthy products in an even brighter spotlight in our children's minds. So here the work this metaphor is doing is it's helping to highlight deliberate actions and responsibility. It's helping to counter that assumption that we saw in those default mindsets that children are just naturally drawn to sugary food, and is showing that actually there's some other stuff at play here. There's the fact that we're surrounded by advertisements, often targeted at children. Now, our final tip for today is that we need to show we can fix this. We need to focus on outcomes and solutions, because our research confirmed that people do already know childhood obesity is a serious issue. But talking about how big a problem it is isn't helping our case as much as we might think. A couple of years ago, this was the word of the year, permacrisis. And if you were to browse a few different news sites today, I'm sure that within minutes, seconds even, you will come across something being described as a crisis. Cost of living, various wars, the climate crisis, I could go on. Now, what's the impact on this on how we think? It's that if all of these things are a crisis, then nothing really is. We have so many things competing for our attention, and we experience this kind of sense of crisis inflation. And when we say that our issue is a crisis, it either has no impact on public thinking, or it can spark disbelief or complete fatalism. It's yet another problem that we can't really solve. So our framing research on a wide range of issues shows this over and over again, that a pure crisis message doesn't deliver the effects we would like it to. In fact, it tends to lead people to have that sense of fatalism, that if the problem is that big to solve, is there any point in trying? So what do we do instead? How do we fight this sense of fatalism? How do we build support for solutions? And how do we communicate about a serious problem in a way that doesn't make people switch off? There are a few things we can do. So first of all, we need to pair problems with our ability to fix them. This means showing that things can change intentionally and deliberately, and that we have confidence in our ability to make change happen. So we can talk about, for example, where we have solved problems, where we have instigated successful programs and policies which have improved children's health, so that people can see it's possible to make a difference. We can talk about the urgency and seriousness of the issue, but it's important not to leave people at that sense of crisis. We have to make them feel that together we can fix this. So this is about balancing urgency with efficacy. For every dose of urgency or crisis in our communications, try including at least 2 doses of can do. And this can apply to tone as well as content. We need to talk about solutions early and often and be specific wherever we can, so that people can see that change is possible. So rather than using less concrete language like we need bold action, talk about what that action is, what that could look like, and how that could be put into place. Lastly, make sure you're not burying the solution after a really long explanation of the problem. This can be a very tempting thing to do. We feel that we have to go into every single part of the problem before we mention the solution. But the problem is often people are busy. They might not even get there. And we need people early on to get that sense that change is possible. So I'd say a good rule of thumb is to mention solutions early, explain the need for them, talk about the problem, and mention them again. So just really make sure that when you're looking at your communications, is there something in there about how we can fix this? And if it's not there, if it's buried, consider redrafting it to rebalance that. So to recap, that's our 4 tips for today. To lead with improving children's health, really make this about improving children's health. Make it about all children, no matter where they live, to really activate that sense of fairness between places. Show how what surrounds us shapes our health, to really build that understanding of where the solutions need to take place beyond individual action. And talk about how we can fix this to overcome that sense that it's just too big a problem to solve. There's much more detail on all of this, plus examples and some further tips that I didn't have time to cover today in the communications guide, so do take a look. And to finish, I just want to share this last slide with you. Frames are not messages, they are ideas. They are a scaffolding which a whole field of practice can use to structure their communications and to write their messages. So you can still tailor them to your audiences, you can dial different elements up or down, but this is about always fundamentally using the same underpinning ideas. Because when a field does this, it can take communications from something like this, where it's like lots of different organizations saying different things in different ways, and it can be quite hard for anybody to get a clear signal for all of that noise, to something that feels much more like this. So this isn't about everyone having to say exactly the same thing in the same way, but it is about using framing consistently to support the same story, to shift understanding in the same direction, and to make sure that those messages and the understanding that we're trying to create can take hold. And it's this sort of consistency which can help to shift the conversation in Ireland and lead to really significant changes that will improve children's health. Thank you so much for your time. I'll stop sharing my screen now, and I'm really keen to answer any questions you have.
Yes. Thank you. Thank you very much, Sophie. That was really, really interesting and informative. I suppose just looking at some of the comments that have been coming in throughout the throughout your presentation there, and it would seem, I think there's probably quite a number of people in our audience who are clinicians working maybe in a clinical setting directly with children and families. And I suppose there's maybe a difference between how we communicate and how the language we use in a one-to-one clinical setting around weight and lifestyle changes, etc., versus this kind of communication which is out into that kind of public policy domain aimed at shaping wider. Are there any insights from this work that might be useful in that clinical space, or is it are they very different, I suppose?
Yeah, absolutely. Great question. And it's something that's come up a few times in the scope of this work. So, you know, the reason we set out to do this was, how do we communicate in order to change policies? That's really what we've been looking at and the results we've been trying to find through the work. But having said that, I think there's definitely plenty of this which could be brought into a more clinical setting, that understanding of how we can communicate in ways that are taking into account the sort of context of people's surroundings. Having a conversation like that with people can be helpful. And there's a piece of work which is not ours, but another study which was carried out with some children, where one group were told all about, you know, drink lots of water, eat your 5 a day. The other group were told about the marketing practices of big food and how that might be impacting on what they eat. And a bit of time was passed, and the researchers looked at any changes on how children, you know, were eating and drinking. And it was the group that were told about their surroundings and marketing practices that actually changed their habits and their eating. as opposed to the group who were just told, eat your 5 a day and drink more water. So I think there's something there which is not within our research, but just showing that understanding of how what surrounds us shapes us actually can also filter through to our own behaviours. So while this work is looking at shifting that sort of wider policy, definitely I think it's that consistency across both angles of this conversation are going to be helpful. We also found in our research, we did a little bit of looking into who are the most effective messengers in order to shift this conversation. And we found that the best people were young people themselves, medical professionals and teachers. So even if it's perhaps not part of your role as a clinician to be shifting policy, you just never know when your conversation might end up having that impact, and you do have a lot of power within your role to do that.
Yeah, and we do, I suppose, for those of you who are interested in how you can maybe strengthen or improve or the communication in the clinical setting around weight, we do have a guide coming out later on in the month, and Sophie, you would have reviewed it in terms of that kind of frame check to ensure the consistency between that public message, policy messaging, and it that hopefully people will find helpful. Just around talking about weight, and the other resource I would point people to in terms of an understanding around overweight and obesity is our MEC module, which granted is adult focused, but it does kind of give that wider perspective and context in terms of overweight and obesity, and how to talk about overweight and obesity with patients. And also we have childhoodobesity.ie also, which is a really good online training for people working in primary care with children and families. So hopefully those pieces will be useful to people. But I suppose if we're looking at that kind of policy space, Sophie, which we're saying this, we want to improve our communications to affect change in that. A lot of the time when it comes to kind of the policies and interventions we want to talk about, and somebody was raising the issue around working with retailers to change the amount of high fat, salt and sugar foods that are their prime position when we walk in. You know, how do we have those conversations without coming across as being finger wagging and nanny state?
Yeah, I think this is really where it's about harnessing that sort of explanation and surfacing context. It's kind of that point again where instead of just sort of claiming like this needs to happen, we need to bring people on that journey with us. And an awful lot of the the third tip that I shared, there's actually so many tips within that of how we can really build that understanding of how what surrounds us shapes us. And I do think that's really key to that sort of making this about, look, we just need to all understand this problem better, and then we all see our role in the solutions, rather than it being about sort of dictating what needs to happen. Once you have that understanding, it then becomes very clear where the solutions need to happen and where responsibility needs to lie to sort of rebalance that away from just individuals.
Okay, and I suppose the reality is our communications will only do so much in a way. It's about helping align things up between what we're saying when we're talking to policymakers, when we're talking to the general public to get their support around change, but also you need things like codes of practice, regulation, enforcement to change things. We do have voluntary codes of practice around the marketing of high fat, salt and sugar foods here in Ireland that include guidance on product placement, but I know that it is not monitored and enforced, and my own experience would suggest that the sector aren't really putting them into practice. I suppose the other thing, I suppose, is like when we're having these conversations in that kind of policy public space as well, is trying to create a sense of urgency and why we need to do something. So a lot of communication, a lot of times when we're writing press releases or going to speak on the radio or whatever, we're like, okay, so what's the big big facts and figures we can use. So things like the cost of obesity, those kind of things. Are they a useful approach, or are they something we should be stepping away from?
I'd say that it's an approach which needs to be used mindfully. So if we think about those sort of default mindsets that are triggered when people think about this issue, that big one is the individual blame. So if we're going out with, just look at the prevalence stats or looking at sort of, for example, the cost of obesity to society, the problem is that that alone is likely to just really fuel that sense of individual blame rather than making a case for those sort of broader solutions. It will just sort of entrench that sense that these people need to change the way that they need to have better willpower and eat better because it's costing us money. So while, particularly with certain policy audiences, we will need to make that economic case, I think it's about sequencing. So first of all, setting out that sort of collectivizing positive case for change, the fact that this is about improving children's health, this is about giving every child what they need to thrive, before getting into the economic argument, because then we're first of all priming people with what we have tested to be a much more helpful, collectivizing way of thinking, which is also likely to broaden out people's perspective of the issue, instead of saying a message which is on its own likely to entrench some unhelpful mindsets, which are unfortunately likely to backfire or get in the way of the sort of changes we want to see. So it's about that sequencing, balancing, urgency of efficacy. Absolutely. Unfortunately, the sort of cost to our health services, or talking about how big the problem is not the silver bullet we might hope it to be.
Okay. And Sophie, the research that you've done and the research that this is based on, have you worked with children and young people in doing it? And is there a difference between their perspective in terms of barriers and opportunities to frame things differently to adults that you've researched with?
So our research is carried out with adults, so looking at shifting that kind of conversation within people who would be able to vote, essentially. But as part of our work, we have engaged, sort of after having done the research, with enabling young campaigners to use the framing recommendations. So there's a great organisation in the UK called Bite Back 2030, which is all youth campaigners. And that was from the very beginning, all these framing recommendations are embedded in everything that Bite Back do. Every young campaigner who joins Bite Back is sort of equipped with using these. And the feedback from those young campaigners has been fantastic. They see this as a way that they can tell their story in ways that they then feel that it's landing and people are hearing them in the way that they want to be heard. So yes, while they haven't informed the research, they've very much been part of how we're mobilizing this. And I think some of the best people are using it as well. They're fantastic.
So it's great. Yeah, I'm aware of Bite Back. They are amazing. And our colleagues in the Irish Heart Foundation had them over to do a talk a number of years ago. And it is, I suppose, what we're talking about today and what our communications guide is hoping to support is equipping all of us to be able to have more effective conversations in that policy environment, because ultimately the changes we want, whether it is in regulation to restrict marketing to children in the digital space, restrict the promotion of high fat, salt and sugar foods in our physical shops and high streets, or to create changes in terms of how our communities are built and our infrastructure. Us as individuals, as voters, are the ones who are going to have an important role to play, isn't it?
Mm-hmm. Absolutely. And it's just about rebalancing the conversation so that, I think so many of us go about our lives thinking we are just purely responsible for our health and that's it. But actually, it's once we're sort of equipped with that understanding of all these things that surround us and impact our health and impact our children's health, we're having the conversation that we need to have, which is much more likely to I think you alluded in your intro, Sarah, to the fact that so much of what impacts our health is actually beyond the realms of necessarily sort of health departments. And so it's conversations like this which are going to, I think, build that much more holistic understanding of what needs to change.
Yes. Sophie, thank you very much for your time and your presentation this morning. I hope that everyone online found it as interesting and as insightful and as useful as I did. I think definitely from the comments coming in and the questions that people have a good sense of it, a sense of, this is looking broader than maybe just what I'm doing in my clinical setting, but there are pieces here that I can use as well. So Sophie, thank you very much, and thank you everyone online. As we said earlier, the guide itself is not in hard copy, so it's available on HSE ie, the Healthy Eating Active Living program website. You'll find it there. Some of the training that I mentioned is available online. The Making Every Contact Count training is available online, as is the childhoodobesity.ie training. Simplest way to find them, Google. And the guide for parents talking with your child about weight, which I referenced, will be available in hard copy when it's published through the usual healthpromotion.ie channel. But we will be letting people know about that, and we will be having a similar webinar towards the latter end of June, where we'll be talking more about that as well. So for now, can I say thank you very much for your time. I hope you enjoyed it, and have a lovely rest of your day.